So good morning and welcome to all of you. My name is Joseph Pache. I'm the Director of Primary Care Homeless Services for the San Francisco Department of Public Health and the Medical Director for Tom Waddell Urban Health. Oh, higher? Look higher or speak louder? Louder. You still can't hear me. Is this bad? Oh, wow. Oh, okay. I'm Joseph Pache with Tom Waddell Urban Health. Thank you so much for coming, distinguished guests and friends, staff, community partners, and many, many others who are here today. I can't believe that we're here, but we are, and it's so great to share this exciting day with you and this exciting new chapter in homeless services and primary care for our most vulnerable co-citizens of San Francisco. I'm very happy to have you all here. I'll just make a quick program note that there's a little reversal in the order, but I think you'll know who shows up and you won't mix the people up. Just bear with us if it looks like the order is out of order. Anyway, I wanted to, again, closer to the mic. Okay, I wanted to again acknowledge what a shift this is today, what this day represents for us as a city, as a health department, and as a clinic, especially a clinic that, two clinics that came together to become one. Two clinics that were flagship clinics in providing state-of-the-art, compassionate, high-quality care, and most importantly, advocacy for our most vulnerable residents. And we've been innovators and leaders long before the space that some of you got to see earlier this morning. We've been innovators and leaders in pushing the boundaries and setting higher standards of care for those who may otherwise have been forgotten, overlooked, or marginalized. We've always put them front and center, and now we have, thanks to the commitment of so many of the people here, a beautiful space to symbolize that commitment and the dignity and respect for the patients that we serve. So I want to thank all the people, and I will do so throughout the program, who've made this day possible. And especially, though, I want to put our patients and clients front and center. I want to thank you for being with us, for entrusting us with your health care, and for making this transition with us. It's been exciting to meet you and to hear how excited you are that this space has come to be, finally. I want to say a couple of more things about the innovations that have existed within the Housing and Urban Health Clinic and Tom Waddell Health Center that now have become Tom Waddell Urban Health. We've had urgent care services at 50 Ivy for a very, very long time, even before there was the Healthcare for the Homeless program. And that program continues to provide services to those who are disconnected from care. I think tourists still come to Tom Waddell when they need some help because we're written up in tour guides. We continue to provide exemplary dental services to the homeless population and those affected with HIV. We continue, despite having this beautiful new space downstairs, have a strong presence and commitment to providing services at the community level in our over 15 community sites. We have a wonderful office-based opiate treatment program that brings recovery right into the primary care setting. We are ahead of the curve with community-based, primary care-based hepatitis C treatment. We have been at the forefront of HIV care, and with our partner, the API Wellness Center, co-run a center of excellence for HIV care in the Tenderloin. Through the efforts of Josh Bamberger and many others, about 12 years ago now, or something of that nature, Josh started the first medication adherence program for people with HIV who were homeless or mentally ill, or both. Many people who were written off as appropriate candidates for HIV treatment because they were thought to be too disorganized to be able to manage it. And we ended up saying, no, we can take care of these people and we can help them. And that program continues. We've had integrated primary care and behavioral health before President Obama thought about it. With our psychiatry and psychosocial services that are embedded and co-located within our primary care services. And of course, I would be remiss if I forgot our Transgender Tuesdays, which is about to celebrate 20 years of service this coming January. And Tom Waddell Urban Health remains at the forefront now as services for the transgender community are about to be expanded. We're at the forefront of developing protocols and access for this community. So a wonderful service that we provide. And now we can do it all in a state-of-the-art facility that is a shining example to all of this city's undying and unwavering commitment to the homeless and marginally housed and other individuals who are suffering with multiple chronic conditions, social isolation, poverty, and the like. So all of that to say, we've been doing it, and now we get to do it in style. So now enough from me. You'll hear some more thank yous in just a moment, but I want to move next to the rest of our program. I'd like to introduce Marcelina Ogbu. She's the Director of Community Programs with the San Francisco Department of Public Health, and she has been a champion of this process and has really, in those moments when we needed help to get through some rough spots to make sure we got this off the ground, she was there and was creative in finding solutions to make sure that this day could be possible. Marcelina.
Okay, I'm not moving because I don't want you to see me. It's just that we need to fix it. Closer. Okay. Okay. Mayor, is Supervisor Kim here? Oh, okay. Supervisor Kim, Director of Public Health Garcia, guest, TNDC partners, would like to really welcome you, and we're very, very pleased that you're here to share this great occasion. The new clinic is actually one of the first ground-up clinic DPH has built since 1979. And so this is incredible. And not only is it incredible, it's at the heels of healthcare reform. So we are very, very thankful. I'd like to thank the Mayor's Office for the financial support, and Director Garcia, not only financial support, but being able to navigate the whole FQAC process for us, and the emotional support, because this has been really challenging to bring two different clinics with different modality of care, to bring them to have a single way of doing things. So it has been challenging, but Tom Waddell's staff has shown that they actually can do anything. They have been able to come together to work to create this incredible clinic. And what Joseph had said about being incredible in terms of the way they provide care to the homeless, to me, I think they epitomize the best practice in homeless care, and that's what's been brought together. And so not only is the practice being brought together, but also what it means is that it's a one-stop care for homeless people. Not only does it have behavioral health, it has housing, it has primary care, it has community programs, outreach, and all that. So it's a one-stop care for patients. And we do hope that that will mean better outcome for homeless patients in San Francisco. I also want to actually thank TNDC, because they've been great partners, great collaborators, and because of them working with us as partners, that's why we have the great clinic that we just had. Tom Waddell is one of the COPC clinics. COPC essentially stands for Community-Oriented Primary Care. We have 12 clinics throughout the city, but Tom Waddell is a clinic that actually serves mostly homeless. But they've perfected the ability, the sensibility, and the vision and commitment on how to serve homeless clients. And I do hope that going into healthcare reform, all of us will actually learn from Tom Waddell how to manage the care of people who have complicated health issues. And so today is really, really a great day. And I thank all of you for coming here to share with us this great occasion. We do look at Tom Waddell Urban Health as the great next way of providing healthcare in the city, not only in the city, but it will also inform us on how we actually operate during healthcare reform. You still can't hear me? So, okay. Again, I really want to welcome you, and for those who haven't seen the clinic, please go and see it. It's going to be a great place. I just want to end with, during the Bay Bridge closure, I actually took Muni and was going to walk, and someone sitting behind me was actually talking about the clinic. And one of the things they were saying is that they were actually afraid of going to this nice clinic. It didn't look as a place for homeless people. And so I couldn't help myself. And I had to say, actually, we think homeless people need good things too. And that clinic, we are not going to say, you need to be in a place that is not up to snuff. We want to treat you just like we treat everyone, and you're deserving of a clinic that looks like the new clinic. And the person looked at me and said, wow, that's really great. So I'll probably try it. And then another day I was crossing the street too, and there was someone else who was talking about the clinic. First, they were afraid to come to the clinic, but when they came to the clinic, it was so, you still can't hear me? Okay, so I'm sorry. So they were concerned about coming to the clinic, and one person, the guy actually did come to the clinic and was so impressed on how welcoming and how they were accepted. And for me, it was very, very helpful to hear that, because we were concerned about patients being willing to come to that clinic, because it was very, very different from the old Tom Waddell clinic. So I do hope that the fact that people are willing to try us, that we will always continue to excel as a clinic that provides care for the homeless. And I do hope that going forward, we'll continue getting the support of the community to make that clinic one of the best clinics in the system, not just for homeless people, but whoever else wants to use Tom Waddell. Again, welcome, and thank you for your support.
Thank you very much, Marcelina. So I think I have to hold it like this close, right, for you to hear me? Okay, great. And I just want to acknowledge Supervisor Campos, who just walked in. Thanks for, there you are. Thanks for coming. Okay, next up on our list is Liz Orland. She's the Chief Operating Officer for the Tenderloin Neighborhood Development Corporation, whose wonderful building you are in, and who we were all here for to celebrate the opening of the residence just a few months ago. Great partnership with TNDC and DPH, and love to have her join us today to make some comments. Liz?
Thanks, Joseph. Can people hear me? Yeah. All right, I'll try to talk loud and into the mic. Okay. Well, thank you, Mayor Lee, Director Garcia, Supervisor Kim, and for everyone else who's here to celebrate with us today. And thank you for giving me the opportunity to represent TNDC and to say a few words. Don Falk, our Executive Director, is out of town. We know he would have loved to be here today, and I am just glad that I get to stand in his stead. The clinic is part of a much larger project, the Kelly Cullen Community, whose auditorium we're now sitting in. TNDC is the developer and the operator of Kelly Cullen Community, and in addition to the clinic, The residential portion of the building houses 172 formerly homeless tenants, all referred by DPH. The building has a gym, this auditorium, an art gallery, and a lot of community space that we have made available to the community. No matter how many times I come into this building, I am struck anew by how awesome this space is. This project is about partnership. It's a partnership between TNDC and DPH. It's a partnership between healthcare and housing. It's a partnership between the physical space and the activities and the life that happens inside. And it's a partnership between this building and the community that surrounds us. On all these levels, this is an exceptional project. TNDC has long enjoyed a strong relationship with DPH. So just imagine yourself stuck on a layover at O'Hare Airport for 6 years. You can imagine how much closer you're going to come to the person you're with for that experience. So here we are at our final destination after 6 years together, and we've learned a lot about each other, and the strength of our relationship has endured and deepened. Since this project was first conceived, we've been inspired by the shared vision for what could be. We dreamed of a space that paired the broadest view of healthcare with the importance of community and with the highest quality housing. This vision was particularly led by DPH staff from the Housing and Urban Health Division. They thought deeply about the design and the care that would be provided here. Our vision survived lots of changes in the economy, changes in the players who were around the table. It survived many architectural and engineering challenges. Oh, and by the way, a restructuring of healthcare locally and nationally. And here we are today, and I think we can all agree that our original vision has triumphed. Core to our vision was clarity that healthcare and housing are inextricably linked. For people who have faced chronic homelessness, it is extremely difficult to get healthy without housing. And it is extremely difficult to achieve housing stability without healthcare and other supportive services. By co-locating the housing and the healthcare here at Kelly Cullen Community, the building is living evidence of the critical synergy between these two. Many of us here today have been proponents of supportive housing since the beginning of the supportive housing movement. We've known the benefit of linking housing and services. And to see this building realized is a statement of how far we have come and where we can go. The clinic itself is open, it's light, it's spacious, and it's green. The design of the space matches the care that is provided here. It's a welcoming, respectful place, and it offers respite to people that it serves, people who don't often enough have access to such space. For TNDC, it's been an honor to participate in the creation of this space. Finally, TNDC and DPH are committed to having our presence serve as a constructive force for continued improvement in this neighborhood. The building is located on a corner that's been a tough one, and we're committed to extending our reach beyond the confines of the building and into our community. Finally, TNDC is just honored to be a part of this project and of this partnership.
So we're going to move a little faster because we have to make sure we get through the entire program. Next, now it's my pleasure to introduce our Director of Health, Barbara Garcia, who actually started her career with the Department of Public Health as the Center Director of Tom Waddell Health Center some years ago, and now is our Director of Health. I want to thank her again for her vision, which created this new space that we're celebrating today, and her undying support for the staff and the patients that we serve.
Good morning, everyone. I celebrate 17 years this week, and I started as the Center Director for Tom Waddell. And it was always my vision, particularly if any of you have gone into the original Tom Waddell, that our patients and our staff deserved a better space. Sometimes in government it takes a little longer. 17 years later, we have a beautiful space. So I want to thank all of you. We have a ribbon to cut, and we still have to hear from the mayor. But I would like to acknowledge our our partners with the San Francisco Clinic Consortium. I see some of the directors here today. I want to acknowledge Charles Range. Thank you for coming today, Charles. Our ability to work together as a city. And let me just note, every person in San Francisco will have a medical home. Despite the fact that healthcare reform will not eligibilize some, like the undocumented, because of Healthy San Francisco, everyone will have a medical home in San Francisco. Everyone will have that. And so we're very proud of the building downstairs in the clinic because it does reflect what people deserve in terms of getting their health care in a beautiful space. So thank you so much. We look forward for you downstairs to help us cut the ribbon. Thank you.
And moving next to the District 6 Supervisor, Jane Kim.
Good morning. It's really great to be here at the Tom Waddell Clinic opening. I know that the clinic officially opened on July 9th, which is actually my birthday, but it's really nice to be here at this ribbon cutting. My first year in office, several of our constituents in District 6 sat in my office and came to my office and said that there was one place that I had to visit immediately in my term, and that was the Tom Waddell Clinic. And they actually came every week, coming into my office to make sure when we were going to schedule that meeting and when I was going to come in. And I just have to say that, and they're here in the audience, they know this, they're not the easiest to please of our constituents. And trust me, they come into the office regularly to let me know what I'm doing right and what I'm not doing right. But the one thing that they sang the praises of endlessly was the Tom Waddell Clinic. And when I finally went to visit the clinic, to meet the staff, to get an understanding of the services that they had, and I got to meet the board, which included many of our constituents, I got to see how much they loved this space and how much they called it their home. And like I said, these are not the easiest to please of the folks that we serve, but they knew that this was a place that they were loved and cared for, and a place that they came with dignity and respect. I've mentioned this before. I mentioned this a couple of months ago when I came for the opening of the affordable housing units that are here under TNDC, which is an amazing new space here in the Tenderloin. But when I spent a night at one of our homeless shelters here in our district, the one thing that became very clear to me is that homelessness is not just an economic issue, but often we at the city, even and public policymakers, treat homelessness as an economic issue. We talk about job creation, we talk about housing, we talk about food. What became very clear to me is that homelessness is also a public health issue. And that many individuals that are homeless not just because of the lack of economic opportunity, but also because of physical health issues and mental health issues, and that we need to do more as public policymakers to address the issue holistically. Tom Waddell has been that clinic for decades, and I just want to thank the men and women foremost that work at Tom Waddell. They are doctors and nurses. They could make a lot more doing many, many other things, but they are so dedicated and committed to this population, to our community, to our neighborhood, that this is where they choose to stay. And you can tell that not just by their service, but the longevity of the service that they provide. And I know that Barbara Garcia came out of Tom Waddell Clinic. I'm so grateful that she is the director of our Department of Public Health, because she truly gets it. She gets the issue. So I have the honor, and again, the same folks came into our office regularly to make sure that we were working on this and that we got the language right, because so that we would appropriately commend and honor the men and women of the staff. But we were asked by the members here to honor the medical director of the Tom Waddell Health Clinic. So I want to bring up Dr. Joseph Pace, who is here, and recognize him. And this comes more than from the Board of Supervisors. This comes directly from your patients and the clients that you serve. In recognition of your leadership in the merging and relocation of two separate healthcare facilities into a single unified primary care clinic that serves the homeless and marginally housed in the Tenderloin and throughout San Francisco, the Board of Supervisors of the City and County offer its highest commendation and appreciation for your leadership in providing team-based care that puts our residents first. Again, this is really a treasure and valuable asset of the community, and I feel so lucky to represent the neighborhood that has the Tom Waddell Clinic. Thank you.
And thank you to whoever's responsible for this. I'm touched, I really am, and if I would be remiss if I didn't share it with our providers, nurses, eligibility workers, our health workers, our psychosocial staff, our psychiatry staff, our facilities people, and of course with you, the patients, because it's you why we're here. So thank you so much. Medical assistants, I forgot medical assistants. Okay. Okay, so next is my extreme pleasure and privilege to introduce the Mayor of San Francisco, Edwin Lee.
Thank you, Joseph. Can everybody hear me? All right, well, I'll try to make sure my voice is loud and clear because I am really happy today. I'm happy to be here for a variety of reasons. You know, you just heard from Supervisor Kim, and thank you, Supervisor Campos, for being here as well. Board and the mayor, we know what we need to do in this city. And just last week, Supervisor Kim and I were there pouring concrete down at the Transbay Center and recognizing that our federal government had put some serious money, the R recovery monies, into that Transbay Center. Well, why do I mention that? Because this building was also the recipient of very special ARA monies, recovery monies. And that's why Leader Pelosi and I and so many of you and Don Falk and others a few months back happily opened the housing in this wonderful, beautiful building. And I know that it could not have been done without a lot of people that have all been on stage, and we've recognized and appreciated them, but I wanted to also give a personal thanks to everyone that has been part of this Kelly Cully Center, as well as the Tom Waddell Urban Health Clinic. That's a wonderful name, Urban Health Clinic, because I think across the country, President Obama and all the people in Congress are looking for models about how to do it right. And in San Francisco, our culture has been, we don't make people just go to primary care hospitals in some centers and make their way. We try to bring those valuable services to where people live. And in Tenderloin, a lot of people in need live in this wonderful community. And when we are through helping to revitalize mid-market, we're going to be bringing a lot of revitalization to the Tenderloin, as you're already seeing. Over 170 units here already for some of the lowest income, formerly homeless people, but also bringing a primary health care center here. I want to thank our health department. You know, today is 9/11. And we pause to recognize, of course, the first responders and the heroes in a man-made disaster that occurred across the country that affected all of us. But the link is that every day there could be a crisis that happens in people's lives. And we need to recognize that we're taking care of people right here in our community, just like we did in responding, whether it was New York or whether it was the Asiana airplane crash in our airport that our health department did so well with our general hospital emergency personnel, or on an everyday basis where people need that health care, whether it's psychiatric or dental or vision or all the other things that we need right here in our community. So I want to, again, thank the health department. I want to give a shout out to Don Falk and Mara Blitzer for their leadership at the Tenderloin Neighborhood Development Center here. I want to extend a very hearty thanks to Lisa Gelfin and Gelfin Partners because they know how to design community-sensitive things and take a historic building and transform its use. You know, people still reminisce their swimming days here at the Y. And people have told me about that. But to see what we're doing right in the center of our city, helping more people. It's the same philosophy as what the Y did in its original goal. Shelter, services, beautiful designs, sensitive designs that Gelfin Partners has been always connected to in their green approach to everything. Guess what they're doing? If any of you have been about the Bay Area, they're already working on the California Hotel on the other side of the bay. They're working on the Gordon Lau Elementary School in Chinatown. They're going to continue working with us on so many of our beautiful historic buildings and transform their use in a sensitive way. Mark Trotz, Margot Antonetti, thank you for your wonderful service as part of our public health division. Of course, I enjoy and continue to enjoy working with Barbara Garcia and the entire staff. The people that will work at this health clinic are going to do a lot of great service because it's not just the 170 odd people that live in this building, it's the 5,000 patients that we'll see every year. 5,000 patients will come through this Tom Waddell Urban Health Center. We're going to be a model for the country yet again, and this is what we're proud of. This is why the supervisors and I work together to make sure that the revenue of the city is strong, because we turn that revenue then into a conversation about what we need to do to take care of everybody in the city. This center and this site represents our city's policy, philosophy, principles, and values about taking care of everybody. And so I want to give a shout out to the doctors, the clinicians, even the medical records staff that's going to be in the back room. They're going to all be here. They've been working their medical magic, taking care of everybody here. I'm proud of this city. I'm proud of being the mayor of everybody that wants to be successful and live rich lives in the city. We need to continue working together. We need to continue connecting the dots, because I don't want the city to be successful for just a good portion of them. I want to make sure everybody is successful, everybody lives rich lives, everybody has a chance to live in this wonderful, wonderful place. It could be Camelot, but right now it's San Francisco, and that sounds as close to Camelot as any other part of this country. Thank you very much, everybody, for working together.
So I know you're all excited to go do the ribbon cutting, but I need to make some last-minute acknowledgments, and I thank the previous speakers for capturing most of the people I wanted to thank. But I'm going to run down.
Okay, are we ready? Yes. Look up about 5, 4, 3, 2, 1, and let's see if the scissors work. Yeah!